Hello, I'm Colonel Michael Greenberg, the Fort Belvoir Garrison Commander. Thank you for joining us today for this week's Facebook Town Hall. We appreciate the opportunity to update you on the installation's COVID-19 response plan and more importantly to address your concerns and your questions. Again, this is co-hosted today. I'm joined by Captain Cindy Judy, the Director of the Fort Belvoir Community Hospital, and I have other representatives in the room. I also have brought in a special guest today as well. And so over the last couple of town halls, we started out with a few announcements. I'll start out with a couple of announcements today. So this month celebrates Asian American and Pacific Islander Heritage Month. Individuals of Asian and Pacific Islander descent have historically served in the Army with great valor and distinction and continue to be critical members of the Department of Defense. Our Equal Opportunity team has planned a virtual event next week celebrating the rich history and contributions of Asian and Pacific Islanders. Please tune in next week on our Facebook page as we show that event. May is also Military Appreciation Month, the time set aside to show appreciation and recognition to our members of the military and also to celebrate Armed Forces Day, which is on this Saturday. I want to personally say thank you to all our service members, active, guard, and reserve, who serve with distinction and pride, remaining true to our individual service core values. I especially want to make a shout out to the thousands who are working in support to fight against COVID-19. Finally, you've seen it today posted on our Facebook page. We will honor the military men and women who have made the ultimate sacrifice on Memorial Day. On May 21st, Fort Belvoir will host the virtual Memorial Day observance at 1 p.m. Join myself and Lieutenant General Darrell Williams, the Director of the Defense Logistics Agency, who will be our guest speaker. This observance will be live on the Fort Belvoir Facebook page. I encourage you to watch and share these important annual observances with us. Now I'll turn it over to Captain Judy.
Hey, good afternoon, everyone. Thanks for having me again. I'd like to start out with some thank yous as well. So this week I'd like to thank the USO and the Red Cross for coordinating the donation of lunch for our hospital's nurses during National Nurses Week. It was a great event and we really appreciate the support. I'd also like to welcome home our USNS Comfort and our 531st CASH deployers who provided care and support in New York City on the ship, in the Javits Center, and in the local hospitals in New York City. We're super, super proud of them. It's Women's Health Week, and Monday was National Women's Checkup Day. So to talk about a non-COVID thing for a moment, I want folks to know that well woman exams and mammograms are available at the hospital. To schedule a mammogram, you call 571-231-3224. That's option 3. Patients are directed to leave a voicemail message. The reason we're asking people to use this option and leave a message is to keep you out of that long queue on hold. Our staff is doing a great job of checking those messages regularly and calling back. And there's about a 2 to 3 week wait in general for those mammograms, for those screening mammograms. We hope that will increase in the near future. What I will tell you is that the reason there's a little bit of a wait is because we're in the process of updating one of our units, and so we will be offering 3D mammography as well in the near future. Just to give you that phone number one more time, 571-231-3224, and that'll be option 3. In other news, I talked a little bit about elective surgery last week, and we have begun our elective surgery this week. And that's going well so far. Again, we're balancing the number of cases that we do with keeping, distance and space in the hospital. So we have not fully opened. It's a phased plan to bring surgeries back, but that begun this week. For those who are interested in just how that process is going, we are screening all of those patients at the COVID tent prior to the surgery. So a couple of days preoperatively, they'll get that test, and then they'll come in for their surgery on the day that it's scheduled. I did get a question, can we keep the drive-through pharmacy? I would love to keep the drive-through pharmacy, but that was never intended to be a permanent solution. So we continue to offer it at this time, and we'll update you when there are changes. It's not a permanent solution, but rather a measure that was implemented to minimize the number of people in the hospital during this pandemic. But activating prescriptions in advance over the phone or on the internet will remain after that drive-through pharmacy option is gone. Again, I don't have a plan right now in the future, but I will in the future close that down, but nothing right now. But activating that prescription in advance is the single greatest way that people can prevent long wait times when they do want to come back to the pharmacy. Okay. To activate your prescription in advance, I'm going to give you another phone number. That's 571-231-3224, option 2, option 2. So same phone number as mammography, only it's option 2 and then option 2 once again. Another question that I had was, have we considered a strategy for an off-site well-child clinic for vaccinations? We've gotten some feedback that some folks are uncomfortable bringing a well child into the hospital. We've implemented a lot of measures at the hospital to keep people safe, and so I don't want families to worry about bringing a well child for a well child visit. It's a necessary healthcare evolution. The bulk of COVID screening going on at the hospital is actually going on in the emergency department and in the tent behind the hospital there and in that drive-through process. So that's one of the ways that we're keeping people from coming in the front entrance where other people would come in. But again, the social distancing, the wearing of face coverings, right? Hand sanitizing or washing hands, all of those things that are important out in the general community are also important in the hospital. One of the things that I can tell you is that pediatrics will continue to schedule the appointments, but they're also going to continue to do virtual appointments as we open up more and more services. So the virtual, the telehealth, the telephone calls, the secure messaging options are not going to go away. And so people will be able to get some care that way. And the vaccinations, we are minimizing risk and exposure in the hospital. We've walked that walk many times to make sure that it's safe. And again, in the waiting areas and the reception areas, we've taken a lot of measures. So finally, the last thing I want to talk about, because I've gotten a lot of questions about, is it safe to just come in the hospital? I want to share with you a lot of the measures that have been implemented. I know that we've talked about them in the past, but there may be somebody new this week that hasn't listened in before. We've restricted access points with staff, patient, and visitor screening when they come in. Face coverings are required by staff and patients, and then obviously in a healthcare setting, when PPE is required, the N95 masks and other protective equipment, that's used instead of those cloth face coverings when it's clinically indicated. We've restricted visitors. This also means, and I know that this is a little bit unpopular for some of the folks on base, that we're not allowing people to come in from the outside on Garrison to eat in the DFAC right now. We're going to keep that closed to outsiders for now because that's part of the restricted access that we need to keep everybody safe and minimize exposure in the hospital. We've reduced in-person appointments, so even though we're starting to see more patients, we still have reduced in-person schedules. We've got a lot more virtual appointments that are going on, and then we're spacing those in-person appointments out so that we can make sure that our waiting areas, the lab, and other areas in the hospital, radiology, are not filling up and becoming crowded as patients go through. And then we've increased disinfecting and cleaning of high-touch areas. So our housekeeping and other staff have taken a look at all of the places, whether it's elevator buttons, door handles, or bathroom faucet fixtures and things like that. They have increased the amount of cleaning that's going on in all of those high-touch surfaces. So it's very safe to come to the hospital for necessary care, and we encourage patients to do so. That's my update for this week.
All right, great, thank you. So it's been a week since we published the framework, and so I put it out last week. I talked through the reopening plan for Fort Belvoir. On the front page of this week's Eagle, we also have that plan laid out, and on Friday or Thursday night we posted that framework as well. Please note that is a framework for reopening. It's not the exact plan, but that gives you at least something to see how we're going to progress in the future. This framework was really guided by the White House Task Force guidelines to reopen America. It was also in consultation with Defense Department, Military District of Washington, the Fort Belvoir Community Hospital, the Commonwealth of Virginia, and Fairfax County. And so there are a lot that go into this plan. I appreciate all the feedback that you gave us. To those who are happy with the plan, thank you. For those who are not happy with the plan, who wrote stuff on Facebook, I apologize it didn't meet your expectations, but please know there was a lot of time and effort put into this plan, and we are trying to be as transparent as we can with the community. So I understand also that everybody wants everything open immediately, or wants something open immediately. And so I appreciate your patience and understanding that, again, this is going to be a conditions-based reopening plan. That's why you don't see any dates on the reopening framework. Just a couple other items that we're doing really to protect the installation. So first, I mentioned it last week, I'm going to thank the hospital again. So they continue to do these public health assessments weekly. We have someone going around to all the high-touch facilities that are open right now. Also, we've added additional on each week as we start looking at or opening different activities. The public health assessments are done prior to opening those activities, and then continual weekly checks are being done as well. If you haven't noticed, we also have a COVID patrol or service members who are going around really trying to enforce the face covering policy letter and making sure we're doing the right thing. Not just patrons, but also employees, both at APs, the commissary garrison, across the installation. Like I said last week, if you see something, say something. If someone doesn't see it, those face coverings are to protect the community, and so they're really critical as we start opening it up and trying to prevent the spread of this virus. I just want to make sure everyone understands there is a policy number 4, which is face coverings and enhanced screening. We've already had people try to challenge the system and refuse to put face coverings on in a facility. Again, we will ask you to put it on. Management will ask you to put it on. If you refuse, one, you're not going to get served in that facility. But two, as seen last week, the military police will be called and will escort the individuals out. Please note, in the policy letter is the ramifications for breaking the policies from refining or revoking privileges to that establishment for a set amount of time, all the way up to barring you from the installation. So please, that policy was put into place to protect the community. I ask for your support as we go forward. So where are we now? And I'm going to start with the Child Development Center. And I know there was a question out there that I'm going to take this week and I'm going to incorporate it into this block. So the question was, it builds an uneasy feeling about when the commander talks about CDC populations and how they're going to reduce the amount of kids per classroom and distribution of kids per classroom. No concrete answers, just planning, but some of us are going back to work soon. What options do we have? And so I'm going to open up to say I understand. Again, 2 weeks ago we were communicating that challenge we have. I will tell you we will gradually expand the capabilities and capacities of the CDC. Where vital personnel will go to essential, allowing more people and more families to use the CDC. We have to adhere to the standards for both employee and child ratios, which right now is a maximum of 10 children in a classroom, health protection condition standards, social distancing, and cleaning requirements. And so what does that mean for you? So if you're going back to work next week and your child is not in our Child Development Center, as I said last week, I'm telling you, you need to find alternate daycare facilities. If you're not going back for a couple weeks, what I can offer to you, I've directed the FMWR director and the CYS immediately. We will begin to notify families next Friday, the 22nd of May, whether you have a slot or you have made the limited capacity, or if you're below that capacity and you need to find another alternate facility. Again, please be patient. We're going to start going through the list. If you are not notified on Friday, please don't take that as you do not have a spot or you're not there. It will take time to notify all the families to engage with them, find out if or when the facility opens back up, whether they're going to bring their children to the facility. If they're not, that frees up space to continue to go down the list. And so again, the intent is starting on the 22nd of May on Friday, working through that next week. Hopefully by the middle of the week, we should notify those families that we believe will have a slot, and those families that need to find alternate daycare. So again, we owe that to you to get that out in a timely manner. Please note as well that although we will tell you that there's a space available, it still does not mean when we open up the facilities that you automatically will go back into a daycare status, because again, we will open up gradually. So we will start with Mission Essential and then work our way through the rest of the list. So again, more to follow. I think the other piece that we were really trying to get after, we talked about it for 2 weeks straight, and I brought Nikki, our special guest, in today to talk a little bit more about it. But we're really trying to recruit families to participate in the Family Child Care Program, or FCC program, which is really using our houses on the installation as an authorized daycare site, and then you get paid for your own business in your own house. And so I'm going to call Nikki up now just to talk for a few minutes about the program and our need for more providers to support this community.
Thank you, sir. Thank you for allowing me the opportunity to speak about our FCC program. At this time, we're looking to expand, and we're looking for additional options to help assist families with their child care needs. So we're looking for individuals that live on post, male or female, who have a high school diploma or equivalent and are interested in helping out our service members and our DoD civilians with their child care needs. So some benefits to becoming a provider are you get to work from home, be able to care for your own children so you don't need child care, as well as provide income into the house. FCC is a long-lasting career. You can take all of your training and experience and transfer it to other installations and other CYS services. You can receive subsidies based on the type of care you provide. Currently, providers who are doing Mission Essential care only are receiving an additional $1,000 incentive a month to continue with that care. You manage your own business, and again, you're supporting the mission. Currently, we have 8 amazing FCC homes open, and we would love for you to join our team. As a reminder, anyone providing childcare in their home for more than 10 hours a week is considered unauthorized childcare. You will jeopardize your housing, possibly be barred from the installation, and just remember that our mission is about the safety of the children. If you're interested in finding out more information, please give me a call. My office number is 703-805-1824. Thanks.
Thank you, Nikki. And so again, this is the 3rd week we are announcing a little bit more about the program. And so if you're interested, please reach out to the FCC office. So other areas of immediate interest to the community, I believe, from the comments and questions that we have: fitness centers, golf courses, and barbershops. And so I want to talk a little bit about each of those. So I think I alluded to last week, I'll talk a little bit more about fitness centers. So fitness centers right now, again, that's more of a higher risk facilities because of the nature of the facilities. And so it is on the list, it's on the reopening plan as well. But please note that the fitness centers will start when they're open to service members only. And then we will gradually expand to groups of clients able to access the gyms. But again, as we launch it, it'll be active service members or service members only first, and then those other patrons will follow afterwards. Okay, barbershops. Talk a little bit about barbershops. And I had a couple questions that came in as we opened the reopening plan, and so I'll address those as well. So again, this is a condition-based program. If you didn't know or realize it, Governor Northam did announce that he was extending for Northern Virginia the closing of non-essential businesses for an additional 2 weeks. So whereas most of Virginia will be starting non-essential services tomorrow, Northern Virginia, to include Fairfax County, is one of those that non-essential businesses will be pushed to the right, and really it's conditions-based. In this area in Fairfax County, our case counts continue to either increase or remain relatively high. And so again, that is one condition that is factored into what we're doing here on the installation. So I do not have a time date yet on when the barbershop is opening, but it's one of our first activities opening. But I think I want to just take time just to tell you what the new norm will be in the barbershop starting out, and then some of those items will be relaxed as we get further on into the process. And so first, to address who it's servicing. Okay, so the barbershop will service, starting out, service members in uniform. And those are both male and female service members. And so, again, thank you, APHES, for assisting with the efforts, and the salon and the barbershop combining or teaming up. So in the barbershop, we will have one hairdresser who's a part of the salon that'll be working 3 days a week by appointment only. Her and the other barbers will be, or the hairdresser and the other barbers will all be giving haircuts out of the barbershop. For the females and males, it will be trim only. Those are the only services that will be starting out. The hours will be 09 to 1700 Monday through Saturday, and then open Sunday 1000 to 1700. It's, again, I mentioned by appointment only, service members in uniform initially. Appointment lines will be announced prior to the opening of the day. Also, what we'll be doing is the barbershop will be asking for name, email, and phone number. Again, those are important as we go forward in case there is a positive case with one of the barbers or hairdressers. We're able to, the hospital is able to contact you with the tracing. Again, we will start out at every other chair and 6 feet distances. Face coverings will be worn by both patrons and barbers and hairdressers. As we reduce HPCon levels, those capacities will increase. We'll have barbershops open at 12th Street, at the APHES Mall, and then at the hospital. Customers will disinfect hands, and then basically all CDC guidelines about disinfecting all areas will be in effect. Waiting areas will be outside the shop, and so you won't wait inside any of the barbershops. And then we're strongly encouraging cashless payments. So everything we're trying to do across the installation is going to be by credit card, debit card only. Again, that helps prevent some of the germs and virus from spreading. And then capes are going to be sprayed with cleaner and air dried between use at least 30 minutes. So, and then all PPE will be actually on hand and planning will be done. So again, that's the barbershop plan, and so it'll be a phased approach. So that's phase 1 of the plan. Okay, as we expand out, it could be weeks, it could be days. Again, it'll be conditions based. The second phase will be opening the salon, and then opening both the barbershop and the salon to more than service members in uniform. It'll go out to patrons at large. And then as we get further along, then additional services besides trims, nails, washings, color, all those services will then be added to the mix. So I want to just give you a flavor of how the barbershops and salon will be opening on Fort Belvoir. I want to talk real briefly about the golf course as well, as that's another activity that will be opening in the future. Again, it'll be conditions based. Right now in Fairfax County, there are golf courses open starting in 8 May. And from what we've heard, we've engaged with them. There hasn't been many challenges yet at the golf course. We actually went out and visited today to see some of their procedures that they're using to make sure we are gathering best practices on the installation as well. Again, they'll start out limited hours. Food and beverages will be limited with bottled drinks. We'll limit one person in the pro shop. Wearing face coverings will be enforced on the greens, also in where you cannot keep 6 feet distances. Showers will not be open. We'll announce it when it comes out. We'll have a good comms plan. There'll be only one person in each cart, unless you have a dependent or someone who lives in the same household, really a dependent who lives with you, and you could prove it, who would be in the same cart. There'll be really no touch points, so no water coolers, no rakes, no benches, no ball washers, no ball cups. Flags will remain in place. Okay, again, those are all areas where we are preventing the spread. It will be cashless. Okay, so you will not be able to use cash at the golf course. And we will be enforcing those. The marshals will be enforcing those standards. Again, if violators are found, they'll be warned. Repeat violators will be barred from the golf course, and they'll be asked to leave. We also will ask for name, email, and phone number. So again, if there is a COVID positive on the golf course, we'll be able to notify you. So again, those are the first 2 activities that we're looking at. And these, we do have basically a recovery panel that we do weekly. All activities on post will come through that panel. We have experts. We have the hospital who joins in on the panel. Myself, the command sergeant major, the deputy, our safety folks, our DPTMS, and other experts to really listen in, make sure that we have all preventive measures in place and we're doing everything to protect the community, as that's really our number 1 goal, is to make sure our community is protected. Okay, I think with that, I'm going to turn it over and let's do some questions and answers. Did you hit all your questions already?
So there have been a couple questions.
Mike?
Oh, turn off the microphone. So we do one while I turn my microphone?
Yes, okay, so while she's working on her microphone, and you could probably grab that, well, you got it. So the PX, it asked, one of the first questions was, when is the PX commissary screening to end? And the answer is it's conditions-based. Okay, and so we're looking at the PX area first, and then we'll look at the commissary area. But as conditions continue on, we will begin to bring down those screenings in each one of those areas. But at this point, we believe those are value added. The second question was for barbershops. Why is Marine Corps Base Quantico allowing Marines to have haircuts, but Fort Belvoir cannot? And they're only a couple minutes down the road. And again, it goes back to the area that they're in. So if you look at the governor's order and who is locked down for an additional 14 days for non-essential services, Quantico is not in the area that is in that Northern Virginia area. And so just because they're 20 minutes down the road doesn't mean that they're in the same quote-unquote area as we are. And so they're in a less case-oriented area. Hence, they have a little bit different conditions on the ground. So with that, I would try to turn it back over to Captain Judy.
All right, sorry about that. I was trying to get rid of some of the feedback that we were hearing in the background. One of the questions that we got was, how do we get required physical exams to enroll children in school? And right now, family medicine and pediatrics are accepting appointments for those. And so you can make those appointments. A lot of the work can be done in advance, the paperwork and stuff, by using secure messaging to prevent your time filling out the paperwork. Instead of doing it in the hospital, you can bring it with you then when you come to your visit. So all you really need to do is call for an appointment in order to get that service. And then somebody asked a question, will pharmacy activation be done at Dumfries? The answer is that it is being done. And rather than give you the phone number, somebody from the staff is posting that phone number for you to have available on the site. So if you just track through the comments, you'll find the phone number and the options there.
Okay, great. So can I get Mr. Dixon to come up? So Mr. Dixon, George is going to come up and talk a little bit about ACS, or Army Community Service. And so I know there was a couple questions over the last couple weeks, so we're just going to give you a small piece of information on that.
Thank you, sir. I'm going to talk tonight about Army Emergency Relief. is a private non-profit organization. AER provides assistance entirely through donations. They receive no federal funding. Established in 1942, the primary mission of AER is to provide funds to help soldiers and their family meet emergency financial situations. These emergencies are generally deemed unexpected and urgent. Examples include mortgages, rent, vehicle repairs, and emergency travel. In 2019, AER processed over 40,000 cases, provided $70 million in no-interest loans and grants, and awarded more than $8 million in scholarships to spouses and children of military. Eligibility. During typical conditions, the following individuals are eligible for AER assistance in accordance with Army Regulation 930-4. Active duty and eligible dependents, military retirees, medical retirees and their families, surviving spouses and orphans of soldiers who died on active duty or after retirement. Army National Guard, active duty under Title 10 USC or Title 32 USC. Full-time National Guard duty activated for 30 days. Expanded eligibility during COVID-19. Assistant Bulletin Number 05-2020-1. Expanded eligibility to Army National Guard and U.S. Army Reserve soldiers activated in support of COVID-19 relief. Method. The fastest way to obtain assistance is through the Commander's Referral Program. Under that program, the company commander or first sergeant is the approval authority for a no-interest loan of up to $2,000. Also, active duty soldiers may go directly to the AER office without going through their chain of command. AER falls under Army Community Services here on Fort Belvoir. For AER assistance, contact Ms. Tammy Brady at 703-615-1972. I repeat, 703-615-1972. Or visit the Army Emergency Relief webpage at www.armyemergencyrelief.org. Thank you for your time.
All right, great. Kevin, you have one question?
Not really, but I'll provide an update.
I wish Kevin would have worn his mask up to the microphone, because it is the sharpest mask suit combination I've seen to date.
Good afternoon, all. Once again, Kevin Renick, Director of Human Resources. I do have one thing to update you on, and that is pertaining to the PCS moves. I know many soldiers are concerned and wondering about, especially those who have been impacted as a result of stop movement. So we have received message from Human Resources Command anticipating that the amendments for the new report dates should be coming to us next week. As we receive those amendments, we will push those orders out to your unit. So please, again, as I always say to you, consult with your unit S1 on all questions and concerns pertaining to your PCS move. Thank you.
All right.
I actually have one related to PCS move that just came in, and somebody asked the question, can I get my medical records for PCSing without going up to the hospital during this COVID time? And the answer is yes. You can call 571-231-3774. You'll select option 1, which will get you to outpatient records, or option 2 for release of information.
All right, great. Do we have any questions out there from the audience?
Yes, sir. Where can I find out more information about becoming an FCC provider?
Okay, so the question was, where can I find out more information about being an FCC provider? If we can just post it on the comments, the phone number. You should have Nikki's phone number. You can call her. She's the FCC program coordinator, and she can give you more details.
Will the CDC notification go out multiple times as more care is made available?
Yes. And so my guidance right now, we're working through this. Again, there are multiple conditions that need to be set. And so we are trying, so the question, I got a note to make sure I repeat the question. So the question is, will notifications go out multiple times if more spaces are available? The answer is yes, they will. And so we are going to try to take a deliberate approach to at least notify the top tiered folks that we know we will have capacity for when we get to a new norm capacity, which could be in a month or two from now. And so That's going to be a conservative norm, just to make sure that we have enough spaces. So if we told you we have a spot, we don't want to come back at the last minute and tell you don't have a spot. And so as we fill up the CDCs, if there are additional spaces, then we will have a wait list, and we will continue to work down that wait list to make sure that we are at full capacity of what we can be at. Again, making sure we abide by all the guidelines put out there, both by the DoD, Army, and CDC.
How do I get my baby enrolled in DEERS? No appointments are available in August through the online scheduler.
So Kevin, can you answer that question? Repeat the question.
So the question is, how do I get my baby enrolled in DEERS due to no appointments is online? So again, this is a situation where we want to ensure that the dependent is covered medically. And so under the conditions due to COVID-19, if you are to come to our ID card facility indicating that this is a new enrollment, we will let you in and take care of you. Thank you.
Great. Okay, no more questions out there at this point? Okay, I'm going to turn it over to Captain Judy for any final thoughts or remarks.
Hey, sir, I don't have anything really other than the updates I provided, other than we just really appreciate the questions and the opportunity to really help educate the community and to work with the community as we get through this together. So thanks so much.
Okay, thank you so much. And again, I think you see the theme where we are talking COVID and trying to answer the questions out there, but we're also expanding this out a little bit to make sure we continue to inform the community on other things that are going on in the garrison and on this installation. And so we've been trying to keep the virtual town halls at 30 to 45 minutes. Today we're a little bit less, which is great. That means we have less questions and we may be putting out more information. I know sometimes we've been a little bit over the 45 minutes, but I think we've kept it under an hour. So again, like all other times, first I want to thank each of our workers that are coming in physically, and those teleworking also to support this installation. Whether it's first responders, folks at the gate, folks at the hospital, those CDC workers, those contractors that are supporting each and every day, those that are supporting our housing. But without each individual person contributing to the entire fight, this installation couldn't operate the way we're operating. And, knock on the table, but we've been pretty successful as far as having controlling the spread of the virus on this installation. So again, we need to be vigilant on what we're doing on the installation. That's why it's so important that we continue to enforce the standards of social distancing, wearing face coverings in those designated areas and where you can't keep 6 feet apart, making sure you wash your hands, hand sanitize, and doing all those things to protect yourself and the community. So again, we want to continue to keep a good record here on the installation. So I ask you for your patience, but I also ask you to continue to do the right thing here. Thank you for participating in this virtual town hall today. Closed caption video will be posted on the Facebook page located in the video section. Thanks for your feedback. We take that to heart to try to make us better. We appreciate your questions up front. We hope we're answering your questions. It may not be what you want to hear, but at least you hear what the answer is. We'll continue to use Facebook Live and the Facebook page as a resource for the latest information, and we'll continue to use the World Wide Web. So please stay tuned for next week. Remember, we're all in it together. The longer we stay at home and apart, the sooner we'll be all together. Thank you, and have a great weekend.